Wendy from Startline Health and Wellness Group. What I've been seeing a lot of these days are people with shoulder problems, anterior shoulder, rotator cuff problems, and sometimes pain in the back of the shoulder, but mostly in the front of the shoulder. And what's happening is when people go to lift their arm, they get a little bit of a pinch in there. Sometimes it gets worse as they come up. Sometimes it actually gets better as they move through the range of motion. When you're looking at the shoulder, you've got your shoulder blade, this is the left side, and then you've got the arm bone, which is the humerus. And it's a ball that fits into the socket. And what this is a very shallow socket and a very large ball. And sometimes the analogy is a golf ball on a golf tee. And that ball has to stay centered in the socket as you raise your arm up. It's up and down. And if it's not staying centered in the socket, if something's pulling it forward, then you get this impingement at the front. So our job is to figure out, and if you keep getting that impingement, what's going to happen is you get an irritation of the rotator cuff. There are 4 rotator cuff muscles, one big one at the front here. You've got 2 at the back, one smaller one and one big one, and then you have one that comes through this notch here, comes right through, and that has to push the shoulder ball down as you raise it up. And that's the one that most people seem to have problems with. So our goal here at Startline is to make sure that the muscles are relaxed so that the ball will stay centered in the socket as you raise up. There's also timing. The shoulder blade rolls up a little bit in order to clear that arm bone. So we want to release the muscles, align the shoulder so it's not being pulled forwards in the socket, and then control and move. And when you're looking at the rotator cuff, you can come over here. Again, this just gives you a better visual picture. So this is the one that comes through on top. These are the 2 back ones over here. And then you follow over here. Can't really see that one as much. It's underneath the shoulder blade, so you don't really get a good picture. We also have the bicep muscle that comes up through here. Over top of those, you have the big deltoid muscle. So what can often happen is this deltoid gets dominating, so it overcomes and overrides the rotator cuff. So what we'll look at, if you do come to see us, is if that ball is being pulled forwards in the socket, do we have to do some intramuscular stimulation to release tight bands of muscles, or are we going to do some shockwave or some hands-on therapy to actually help get that shoulder back if there's scar tissue being pulled forwards? So thank you. If you have further questions, please go to startlinephysiotherapy.com.